Hello, welcome back to my channel. Today we're going to talk about how internet porn is reshaping our minds. And this is a topic that's been hot. Even Time magazine covered it. So what they said here is why young men who grew up with internet porn are becoming advocates of turning it off. So today I'm going to talk about my research, about why this is. So let's get started. For 3 years, I was the head of addictions and resilience research, where I led a team of psychiatrists, psychologists, and other physicians to study addictive behaviors. And today I'm going to talk about internet pornography. I didn't start out wanting to study this topic, but my department head, Dr. Warren Clam, who is an adolescent psychiatrist, said, "Dr. Doan, I need you to study internet pornography because it's affecting a lot of people. Patients are coming in and complaining about symptoms and problems. And so as physicians, when we listen to patients, we can actually learn a lot." So let me clear the air and say that there's no clinical diagnosis. There's no diagnosis in the DSM or any textbook that pornography is addictive. However, that's not an excuse to say it doesn't exist. So before we had diseases like, let's say, tuberculosis, did those diseases really did not exist? No, we have new diseases popping up all the time, or we have old diseases that have yet to be classified. So internet pornography is relatively new. So for example, years ago when we received pornography through, let's say, the mail, it was once a month before we got our dopamine hit. And when we got our dopamine hit, it was only a static picture. To get videos, we had to go to some shady truck stop or some red light district vendor to get the videos. So that had a high barrier of entry. But now, internet porn hits us quicker than the old magazines where we had a month to rehab and then we got another hit again when the new magazine came 30 days later, but they're still just static photos. You know the saying that it says that a photo is worth 1,000 words? Well, a video is probably millions and millions of words. And that is why pornography, specifically on video, is very intense. It hits the brain like digital crack. And so it's gonna affect us physiologically. Now, if you wanna know about digital sugars and how that hits our brains, I have a digital sugar video that you can watch here. Because I'm here to help you and help you understand what's going on so that you can break this destructive cycle. The paper that I'm talking about was published in the journal Behavioral Sciences, and its titled is Internet Pornography Causing Sexual Dysfunctions, a Review with Clinical Reports. So really, this is just a case report where in medicine, if we notice something, we write a case report. We don't do a study yet because we want to introduce the idea. In this paper, if you notice, when you read a scientific paper, it's important to go through who are the authors and what are their affiliations and what are their specialties and credentials. So the first doctor here is Dr. Brian Park. He's a flight surgeon who was a medical student who worked with me, who understood and actually listened to me as a professor when I talked about digital drugs and how video games and social media and the phone and videos can be addictive. So he astutely saw how many of his patients were addicted to pornography and they had erectile dysfunction. Because they were young men, they were 20 to 30. Now keep in mind that basically most 20 and 30-year-olds should not have erectile dysfunctions. Most erectile dysfunctions are due to vasculogenic, meaning that 50 and older will have less perfusion to those organs, so therefore the older individuals are the ones who have erectile dysfunction and need medications like Viagra and Cialis and other medications to help them basically get an erection. However, he noticed that young men were getting problems with erectile dysfunction. This is not normal. This is a healthy population of people that he's treating as a flight surgeon. So then he started asking the questions. What are you doing with your free time? What are you viewing? And these men who are desperate revealed that they are using a lot of pornography. And we're gonna get into those 3 cases later into this video. The second author is Gary Wilson, and God bless his heart. Gary passed away during COVID, and he's a good friend of mine. And if you wanna learn more about Gary Wilson, go to his website, Your Brain on Porn. It's in the description below, as well as his TED Talk on Your Brain on Porn, which reached millions and millions of people. I learned so much from this man. He's not a PhD trained, he's not an MD, but he is so smart. He can read scientific papers, understand the concepts, and basically communicate in a way that others can understand. So one of the things that he taught me was about the Coolidge effect. So the Coolidge effect is a study that was done back in the 1950s, where if you take a male sheep, a ram, and expose it to a female sheep, a ewe, what happens is it takes longer and longer and longer and longer for the ram to hump the ewe and basically ejaculate, okay? Because it's now bored with the same presentation. However, if you switch out the ewe with new female sheep, the ram will engage until exhaustion. The mammalian brain wants variety. That is why you never catch a pedophile or a sex addict with just one image. You never catch one that just looks at one image and go, oh, I love this image. And for the entire life of that individual only looks at one image. This is why the porn industry has exploded to over $100 billion a year in annual revenue. Because people who are using pornography, they have to escalate like that male sheep. They gotta look for new novel. It doesn't matter what they look like. It doesn't have to be beautiful. They have to look for new novel stimuli in order to keep their brains and their sexual organs going. So that is why and how internet pornography can become so addicting. And we'll get to that with these cases that we discuss. So the next author we have is Jonathan Berger and Matthew Chrisman. These two are urologists. So I recruited urologists to look at this data and look at the science and look at the review papers. We review over 150 academic papers in this one single paper. So I asked urologists to come in. Are we off track here? Are we on point with what we're saying? We had two urologists who completely agreed with what we had in this paper and even put their name on it. We also had Bryn Reyna, who is a psychiatrist, and then also Dr. Warren Clam, who was the head of psychiatry. Dr. Frank Bishop was my department head in ophthalmology. I was both associated with the Department of Ophthalmology and Department of Psychiatry. So in a nutshell, that is who is presenting this research to you. One trend that we notice is that men younger than 40 are expressing erectile dysfunction and sexual dysfunction. Note that usually vasculogenic and other physiological erectile dysfunction should be associated with older age, with hypertension and high cholesterol, not younger men. So why is it that younger men are getting this problem? So there's actually this Time magazine article that talked about why young men are actually avoiding porn. And it's actually the no fap movement. The no fap movement are men who notice that basically if they stop looking at porn, feel better and have better sexual function. And that is why the no fap movement is taking off. You can do these tests yourself. If you stop using porn, I can guarantee you your sexual functions will get better. Your libido will increase. You can do that test. You can unplug for 30 days and you can see for yourself whether pornography had an effect or not. It's that simple. So these are the trends of complaints that we observed in the literature. Young men are complaining of erectile dysfunction, delayed ejaculation, and low libido. These trends didn't really emerge until 2006, where we had tube sites and other porn sites where the dopamine hit is fast and unlimited. So the problem is we're getting hit with dopamine so hard, so big, that the body has to develop tolerance. So what I mean by this is that when your brain fires dopamine, it goes to the hypothalamus to stimulate it, then it stimulates the pituitary gland, then you have the pituitary gland stimulate the adrenals, the gonads, and the thyroid. So you have the hypothalamus pituitary adrenal, hypothalamus pituitary gonadal, and hypothalamus pituitary thyroid hormones being regulated and upregulated. Now there is a negative feedback loop. So when hormones increase in your bloodstream, it goes to the hypothalamus and turns off the sensitivity or turns down the sensitivity. That's called the negative feedback loop because the body knows that it can't be revved up all the time. So as a result, it's going to take more and more stimuli to stimulate more dopamine in the brain in order to stimulate those axes in order to get the physiological arousal that the individual requires. It's basic neuroscience. It's tolerance that's being developed through an action or behavior. And in this case, it's looking at pornography and sexual content that's causing tolerance. So this first case is a 20-year-old man who's had 6 months of erectile dysfunction and difficulty with just partnered intercourse. So he came into the doctor and wanted to make sure everything's okay, also wanted maybe a pill or something to help him. So what we found out was that he had difficulties maintaining erections and achieving orgasm throughout his military deployment. Upon return back home, what he found was that he was not able to ejaculate during intercourse with his fiancée. So this young man was separated from his spouse for over 6 months, and he used a lot of internet pornography, was not able to get an erection or ejaculation. He had a medical workup, a urology workup, everything was normal, and he just wanted a pill to basically take care of his erectile dysfunction. So when we took a complete history, he was actually using a lot of internet pornography. Because his medical evaluations was normal, we just recommended that he stop using internet pornography and see what would happen. And we placed a urology consult for him, which he saw urology in a month. But before he saw urology, within a month, he regained sexual function and was able to have normal sexual intercourse with his fiancée after stopping internet porn completely. And the urology evaluation was completely normal. So in medicine, when you come to me and I have a rash, let's say, and let's say it's because of a new detergent, and I take away the detergent and the rash goes away, I know it was the detergent. It was not anything else in my life because nothing else has changed. So in this case, the only thing that changed for this young man was the use of internet pornography. So when he took it away and he regained sexual function, it had to be the internet pornography. So in the second case, this is a 40-year-old African-American gentleman who was having problems with erections in the previous 3 months. He reported that when he attempted to have sexual intercourse with his wife, he was having difficulty achieving the erection and difficulty maintaining it long enough to orgasm. Ever since their youngest child left for college 6 months earlier, he had found himself masturbating more often due to increased privacy. He formerly masturbated every other week on average, but then increased to 2 to 3 times per week. He had always used internet pornography, but the more often he used it, the longer it took to orgasm with his usual material. This led to him using more graphic material. Soon thereafter, sex with his wife was not as stimulating as before, and at times he found his wife not as attractive. He denied ever having these issues earlier in the 7 years of their marriage. He was having marital issues because his wife suspected he was having an affair, which he adamantly denied. The only thing that's in his medical record that was significant was for high blood pressure, and at the end of the exam, his issues were attributed to heightened sexual stimulation threshold from exposure to hardcore internet pornography and frequent masturbation. He was advised to stop watching hardcore porn and decrease masturbation frequency. 3 months later, the patient reported that he tried really hard to avoid hardcore internet pornography and to masturbate less, but he just couldn't do it. He said whenever he was home alone, he found himself watching internet pornography, which would eventually lead to masturbation. Not watching made him feel like he was missing out, which made him irritable and made him want to do it even more, to the point where he looked forward to his wife leaving the house. He was offered a referral to sexual behavioral therapy, but he declined. He wanted to try to work on this behavior on his own. This is a man who's probably addicted to pornography. He couldn't stop on his own, and he's having problems in his life. So keep in mind that there's no clinical definition of internet pornography addiction or pornography addiction, but when a addictive behavior or a certain behavior becomes disruptive to daily normal activities or daily normal life, and that's by definition an addiction. In this case though, we included this case because of the escalation element. So he had to use more and more hardcore stuff in order to get stimulated. Okay, so the third patient is a 24-year-old man who was in the inpatient unit for a suicidal attempt. During the evaluation and treatment, he admitted to drinking alcohol, even though he was advised not to drink alcohol with antidepressant medications, which he was on. He also has a history of having addiction to gambling, internet gaming, and pornography. He revealed that he had become concerned over his use of pornography, spending an excessive amount of time, 5+ hours per day, viewing online pornography for about the last 6 months. He also realized that he had diminished sexual interest in his wife, manifested by his inability to maintain and sustain erections, preferring to view pornography where he had no erectile issues. When he became aware of his excessive use of pornography, he stopped viewing it completely, telling us that he was afraid that if he viewed it to any extent, he would find himself overusing it again. The amazing thing is that after he stopped using pornography, his erectile function returned. So here's another case where there was erectile dysfunction associated with pornography. He stopped pornography. That's the only thing that changed. The only thing that changed in this 24-year-old's life was stopping pornography, and he had gained sexual function. If there are thousands of men on NoFap and your brain on porn who are struggling with erectile dysfunctions associated with excessive internet pornography use, I can guarantee you there's a lot more out there. Because a lot of men are not going to admit it. They're not going to go to a discussion forum or an internet site or a doctor to admit that they're overusing internet pornography. So what are the broader implications here? Well, it's going to reduce sexual satisfaction and connection in partnered relationships. It's going to increase your preference for artificial stimulation over real life human interactions. So as clinicians, we got to do better in learning how to diagnose erectile dysfunction associated with pornography better, how to treat it, and how to intervene. And that will come down the road, but in the meantime, this is what you can do. First, let's start a discussion. If we don't discuss it and we keep it in the dark, nothing gets better. But when we're open about this and we're now collaborating and talking and having a conversation, things can be solved. Number 2, stop using pornography. All you have to do to test this out, if you're having erectile dysfunction and you think it's because of pornography, stop the pornography for a month and see what happens. Stop porn for a month and see if you regain function. If you don't regain function, then go see a urologist to evaluate for other physiological and vasculogenic causes of erectile dysfunction. However, if you're not able to stop internet pornography, you may be addicted. At that point, you need to have the help of perhaps a 12-step group, like Sex Anonymous or a Celebrate Recovery, or find a therapist who specializes in porn addiction and get some help so that you can get off the porn. I would love to know your thoughts on this, so please post in the comments below and as well as questions. If you like this video, please like, share, and comment, and please remember to subscribe so you get my future videos. Until next time, have a wonderful day.